what is a public option, what's single payer? I think you all know, but there's a lot of people out there who don't. There are a lot of people out there who get bamboozled by the television commercials, and to the point where you see a woman with Medicare say, keep the government out of my Medicare. And while people in this room are very well informed, it's pretty scary to think that people think that they're not getting their health insurance from the government when they have Medicare. Medicare really is an example of single payer. The government covers your health insurance, you choose your provider. And if we're just talking about public option, and people don't seem to understand what that is, it's a lot like Medicare for people less than 65. You know, I was attending a healthcare forum for seniors in Warrensville Heights, and a 90-year-old woman named Belle Lykover stood up, and she said that in 1936, when she was graduating from high school, they were doing debates, and the issue they were debating was universal health care. And there were sides that were pro, one side was pro, one side was con, and she was on the con side. She said the arguments they used in 1936 are the same arguments they're using today. Yep. Pretty amazing. And then she looked out among the audience, and most of them were seniors, and she said, how many of you are on Medicare? 75% of the hands went up. And then she said, how many of you like your health insurance? Same hands went up again. And that's what we have to convey to people, because you know, my mother, God love her, she's Republican. And she's moved to Louisiana since she got remarried after my dad died. And you know, I hate to tell you, but they watch Fox News a lot. And so, you know, we'll have our discussions, and she's very reasonable. She's one of those like vanishing species of the moderate Republicans. And she'll say to me, you know, Jennifer, I think President Obama made a mistake by going after health care first. He should have been working on jobs. But you know, these aren't bullet points. It's a finely tangled web. And if we're going to help small business create more jobs for people, one of the best ways we can help small businesses to find a way to take the load off their back of providing health insurance for their employees. Because if we have a way for people to get health insurance other than through their employer, that frees up the employer to create more jobs for people. And you know and I know that if we're going to say, and we all believe, that health care is a right, then the free market economy doesn't exactly stand for equality. It stands for survival of the fittest. And when you have for-profit health insurance that seeks to make sure that their shareholders are covered, then those of us who have severe health problems, who cost the most money for the insurance company, are going to be the ones that are going to try to find a way to cut out, whether it's domestic violence or something even more preposterous than that, why you can't be covered by health care. And the more people who get cut out of the system, the more we're all going to be paying for it, because when something catastrophic happens, they still have to get health care, and the hospital's not going to turn them away. And in the end, we're going to be paying for it through higher insurance premiums, through higher costs at hospitals, through chopping up those services into little pieces. And Congress's response to it up to this point has been, well, if the hospital's skimping and only has one nurse in ICU while the second one is out on a code blue, and there's a mistake made, well, that's not really something we're going to, you know, make any allowances for. We'll just say malpractice insurance is getting too much, and we'll find a way to do more tort reform. In the end, it's about the few people at the top getting richer, and the rest of us who are working hard, trying to do the right thing, paying for it. So, Becky was right. It's going to take courage. It's going to take people who are independent-minded in the Congress and who are willing to say, I will do what I think is right, even if it means I'm not elected again. Because in the end, history will judge what we do, and we've got to do something now. Thank you.